Welcome to the module on developing registries. Here are the key clinical activities identified for pediatric transition planning. We begin with the first activity, develop and maintain a registry for transition planning. In this module, we describe what a registry is, discuss its importance and benefits, and explain how to build a registry. We include a practice assessment to gauge your practice's effectiveness for knowing and managing its patient population. Finally, we provide examples and resources for you to develop at least one useful registry for your practice. Here is a more formal definition of a registry. A patient registry is a system of accessible and clinically useful information for your patient population. It uses an organized approach to collect and display information for purposes of identifying specific patient populations. Examples include a computerized database, list, spreadsheet, index card system, color-coded chart, or electronic medical record that incorporates registry capabilities. Registries enable physicians and staff to know their patients, reach out to patients by various criteria, for example, age, gender, diagnosis, or need, address individual patient needs on a timely basis and track outcomes and results, and manage, measure, and improve the quality of care delivered to specific populations. Registries are invaluable to quality improvement activities. Practices need to identify transition-age youth with and without special health care needs and/or intellectual disabilities as a first step toward supporting and facilitating the transition planning needs of youth in the practice. Here are some benefits of registries focused on improved patient care. Take a moment to review them now. A patient registry is a list of patients with common health characteristics, needs, or concerns. You already use registries in your practice if you keep the face sheets of patients with asthma arranged in a binder, create a list of appointment no-shows, or put stickers on charts of patients who require an annual influenza vaccination. These are all examples of informal registries. The next slides will describe more formal registries for use in a variety of healthcare settings, including transitions planning. Here's an example paper-based registry that uses index cards to maintain information about patients with certain health conditions. Practices use the registry to monitor condition prevalence, treatment, and outcomes. Using color-coded cards for gender and stickers for condition quickly identifies and extracts all patients with a specified condition. Physicians and staff improve the quality of clinical care and patient satisfaction by planning service delivery effectively with a registry. Here are some ways to use this example index card registry. Pull cards with yellow stickers to invite patients to a group diabetes education event. Pull cards with green stickers to ensure all patients have an asthma action plan. Or pull cards with red stickers to confirm that patients completed a preventative care visit in the last 12 months. You can use the link provided to learn more about this card registry example. Here is an example computerized registry in spreadsheet format for patients with special health care needs. It is easy to create and maintain. Enter the information manually or extract and download information from other sources, such as billing or electronic health records. Start small with your registry design and expand it to fit your needs. In this example, the registry displays information in alphabetical order by patient name. Additional columns show the patient's gender, date of birth, age, which the registry automatically calculates from the date of birth, provider, diagnosis, complexity score, and date of last visit. For convenience, we included a copy of this registry example under the Tools tab. Spreadsheets offer a great deal of flexibility. You can add or delete columns as your needs change. You can sort or arrange information by any field. For example, you can sort patients by their name, their provider name, their age, or their diagnosis, in ascending or descending order, as shown in the drop-down menu in the upper right corner. You can also filter data to reveal only the data you need. For example, only patients with a complexity score of 3, or only patients of a specific provider, or only patients ages 14 and older. Spreadsheets also offer advanced functions such as conditional formatting. For example, flag all patients in red with a complexity score of 3 and whose date of last visit is more than 1 year ago. If you have not already done so, please take a moment to review the example spreadsheet before you continue. Now that you are familiar with registries, what they are, why they are important, and what they look like, it is time to apply this information to your own practice. We begin with a practice assessment. The assessment will determine your ability to identify patients by transition planning characteristics. It will also determine how your practice identifies and manages your patient population by factors essential to addressing individual patient needs and tracking outcomes in a timely manner, and managing, measuring, and improving the quality of care delivered to specific populations. Before you continue, use the link provided and complete the Registry Practice Assessment. Find out how well you know and manage your patient population. The practice assessment you just completed may have revealed some strengths, as well as opportunities for improvement. Does your practice have a registry or registries in place? If you answered no to question 1 on the assessment, the first improvement idea is to plan, build, and implement a registry. Review the tips in the column on the right to help you do this. If your practice already has a registry in place, yes answer to question 1 on the assessment, look for ways to improve the registry. Perhaps you can expand your registry to support other population groups, to track evidence-based care delivery, or to organize care for patients with a specific chronic condition. You may also consider adding advanced functions, such as automatic alerts or reminder recall systems to flag when patients need certain immunizations, laboratory tests, or other services. However, be aware that a registry supplements but does not replace the patient's medical record, which should document the patient's care at every encounter. What elements might you include in a transition planning registry wish list? All suggestions and examples are for consideration only. Tailor your registry to your practice's unique needs based on specific care interventions you want to improve and the data needed to track their delivery. Suggested elements for a transition registry include age, gender, and diagnoses, transition action items, and advanced functions such as alerts when services are overdue. For patients with special healthcare needs, the registry might identify the level of complexity or intensity. Use the links provided to review the complexity scoring tool examples. For convenience, we expanded the basic Excel registry you saw earlier to include elements of transition planning. Note the new columns. The Transition Excel registry included in this training aligns with the key clinical activities by tracking date the transition policy was provided, date that healthcare skills were last assessed and goals discussed, date that insurance, benefits, and services information sources were provided, date of last medical summary update, and so on. Use the links to open and explore the example transition registry and accompanying guide, which explains the conditional formatting applied to the worksheet. For example, conditional formatting alerts for when services are overdue. Be sure to check out these resources before you continue. Whether you use the example Excel worksheet provided or begin with something more basic, here are some tips and strategies to guide your registry development. Before you begin, identify a transition or registry champion. Then, when beginning registry development, identify a clear purpose for the registry. What care interventions do you want to improve? What information do you need to accomplish the improvement? Start small and expand from successes. Even a small data sampling is a good source in PDSA cycles and rapid tests of change. When adding patients to the registry, you might begin with a simple recall. Ask physicians to list patients that meet the registry criteria from memory. You can also review billing records or perform chart audits. Another approach is to ask families to complete the CAHMI Children with Special Health Care Needs Screener, which identifies patients with special health care needs. There is no one-size-fits-all method. Take an approach that makes sense for your practice and add names as you go along. For a registry to be useful, you must regularly update its information. Establish protocols with checks and balances for data integrity. Consider delegating registry maintenance to one or more designated individuals. For example, a care coordinator, triage nurse, referral clerk, or medical administrative assistant. He or she should be familiar with medical terminology, organized, trained in spreadsheet or computer applications, and skilled at patient contact and motivation. Finally, think of your registry as a work in progress and review it routinely for areas of improvement and/or expansion. Ask the important question, is this registry working? Ask everyone and ask often. Here are some tools and resources to help you develop and maintain registries. They are located under the Tools tab for easy access. Here are some websites, articles, and guides on registries.